Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I talked about, do patients in ICU have the right to be treated at home? You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to answer a question that we get quite frequently. The question is, what are the outcomes for patients at home on ventilation and tracheostomy? So let's look at it. The short answer to this question is that it really depends on the client. There is no one-size-fits-all answer to the question. What all of intensive care at home clients have in common is that they want and do improve quality of life and or quality of end of life at home, and that is a major achievement in and of itself. One of the most important issues is that goals of care are different for different clients, and it really depends on the individual. Outcomes range from ventilation, weaning, tracheostomy weaning, all the way to full recovery, and also sometimes to end-of-life care and palliative care at home for patients that would otherwise be in intensive care long term. Some of our other clients can live a good quality of life, and they might be on a ventilator for the rest of their lives because of the nature of their injury or condition. They can live a good quality of life at home in spite of ventilation and tracheostomy. They can live an active family and social life at home with 24/7 intensive home care nursing. The alternative would be to stay in intensive care indefinitely on life support with no quality of life. The outcomes when patients are at home on life support with ventilation and tracheostomy for the rest of their lives is the improvement in quality of life and the cutting of the cost of a $5,000 to $6,000 per bed day intensive care bed by approximately 50%. Other outcomes for ventilated and tracheostomized intensive care at home clients are good quality of end-of-life outcomes where clients simply have expressed their wishes to approach their end of life at home surrounded by their family instead of dying in a sterile intensive care unit. We have provided and we are providing palliative care and end-of-life care for ventilated and tracheostomized clients at home. Other treatment options at home for intensive care at home clients can be around BiPAP or CPAP ventilation, also known as NIV or non-invasive ventilation. For example, we have been and are currently providing BiPAP and CPAP ventilation at home for adults and children. We have been successfully weaning a medically complex toddler off CPAP ventilation at home. We have also been providing end-of-life care for another medically complex 18-month-old toddler on BiPAP with seizures that left pediatric ICU in order to approach end-of-life at home, surrounded by his loving parents, grandparents, and family and friends. For all of these situations that I just mentioned, we published case studies, and you can read those case studies on our website on the case studies section, and I put some links towards those case studies beyond this video in the written version of this blog. There are other clients we keep out of ICU and pediatric ICU as well that are not necessarily ventilated but have other complex neurological medical conditions where they have regular glomal or tonic-clonic seizures and their airway becomes unstable and compromised during those seizures. Our critical care trained nurses then manage unstable airways at home with Guedel airways, nasopharyngeal airways, suctioning, oxygen, jaw thrusts, bag valve masks, etc. to maintain a stable airway. All of our clients and their families have opted to continue care and treatment at home instead of intensive care, with 24/7 intensive care nurses coming into their home to improve their quality of life or quality of end of life. Funding bodies have also embraced the concept of intensive care at home because we are reducing the cost of a $5,000 to $6,000 per bed day in ICU or pediatric ICU by approximately 50% at home. So if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or help you get out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you want to know how to get funding for our service, or if you have any other questions, please send me an email to patrick@intensivecareathome.com. That's Patrick just with a K, or call me on one of the numbers on the top of the website. Also, have a look at our career section. We are currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area, in the northern suburbs, Mornington Peninsula, and in South Gippsland, Victoria. We are an NDIS, TAC, and DVA approved community service provider in Australia. Also, have a look at our range of full service provisions on our services section. Have a look at our case studies on our case study section. And we have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.